First question, which of the following anatomical term best describe the motion in the picture? So it is away from a midline. Picture la thanirikkunnathu, the extremities are away from the midline. So what is that called as? Away from the midline, it's called as abduction. Okay, so the answer is abduction. Next question. Which of the following above location represent the best site in inspecting chest retractions in a child with a lower respiratory tract disorder? To identify lower respiratory tract disorders, already picture is given. This is the picture. Just compare and then drop your answers. Lower respiratory tract disorder. Since it is lower respiratory tract, chest retractions will be found over the lower area. So please select lower area, substernal retractions and subcostal retractions. So the answer is D and E. So it comes option D. Okay, D is the answer. Last one. Question number 3. Your patient's finger stick blood sugar is 300. According to the following sliding scale, how many units you would give to your patient? $300 comes in between 251 to 300. So it is 14 unit. So the answer is C. Very good. Next, the nurse is caring for a diabetic child whose 11 a.m. blood sugar monitoring is 269. So order is given. According to the coverage schedule, how many units you would give to your patient? 269.
6 units.
It's 6 units. Fine. Question number 5. The following syringe contains morphine sulfate 2 mg per ml. How much total morphine this syringe contains? How many ml is there in the syringe? What is the total volume in the syringe? It's 2 ml. It's 2 ml. Yes. So 1 ml is equal to 2 mg. So there are total 2 ml in that. So the total answer, the correct answer is
4 mg.
okay. Next question. The following syringe, 6th one. Following syringe contains 2 gram of morphine sulfate. How many gram are there in 1 ml? Total, the syringe contains 2 ml. 2 ml is equal to 2 gram. So the question is, 1 ml contains how many gram?
1 gram.
2 ml contains 2 grams. So 1 ml contains 1 gram. Very good. The following condition may develop in female. What is this following condition? Hirsutism. That is because of increased production of dash.
Androgens.
Yes,
Androgens.
Next question. What is the name of the process of movement of a dissolved substance that is solute from an area of higher concentration to an area of lower concentration?
Diffusion.
What is this called as? Movement of solute from higher concentration to lower concentration.
Diffusion.
It is diffusion. Okay. Next question. Which of the following is the incision site for open cholecystectomy? Open cholecystectomy.
Right upper quadrant.
Right upper quarter is given. So you can select the number.
2.
It's 2. Yes. What is cholecystectomy?
Removal of gallbladder.
Removal of gallbladder. Okay. Question 10. Which of the following is the incision site for open gastrectomy? Open gastrectomy.
D.
See in the below picture, sleeve surgery based on incision type. You can just imagine, like compare that. Open sleeve surgery. First picture. Second picture is laparoscopic surgery. There are 6 holes. Single incision surgery. Yes. So answer is?
D.
What is the incision? You can just take the number.
4.
Yeah, number is 4. Fourth one. That means D. Yes. Okay. Question number 12. Which is the most probable type of arrhythmia in the ECG? Lead 2.
Atrial fibrillation.
So what is this? Atrial?
Fibrillation.
Yeah, atrial fibrillation. It is not ventricular something because QRS complex is normal. Question number 12, where QRS complex is normal. So it is not related with the ventricular fibrillation or ventricular any abnormality. So you can remove C and so either atrial fibrillation or either atrial flutter. So here P wave look like a wavy manner. So it is atrial fibrillation. Next, what is the 13th number? 13. What is the most probable type of arrhythmia? Whereas QRS complex is not normal. So it is something related with the ventricular. So A and B can be removed. Ventricular tachycardia is the answer. Okay. Next. The following picture suggests that the patient has. What is this indicating? Clubbing of fingers. Yeah. So it is indicating clubbing of fingers is a sign of hypoxia. So the answer is pulmonary. Very good. You can read question number 16. When a patient is operatively, which of the following position would the nurse use to protect the client? What position you will give?
D.
Patient is vomiting. So A position is wrong. C is also wrong. D, B and D is okay. But the better position is lateral and the head is tilted towards one side. So the answer for this question is
D.
Question number 17. The following picture represents the pain distribution of which nerve affection? The shaded area, white shaded area where the patient is having pain on all of these areas. It is indicating which nerve affection? It is not T3 and T6 because thoracic vertebra, if that is affected, below the nipple, the sensation will be impaired. The hand will be okay. So either it will be C2 or C6. So what is the answer? If it is C2, below the neck, the entire sensation will be altered. So it could be C6. Okay, fine. On assessing the patient's pressure ulcer, the nurse would document this as stage.
3.
Stage 1, 2, 3, or 4.
Stage 3.
It is not 4, it is not 1, either 2 or 3. So this is 3, where the subcutaneous areas are affected. Okay. Next, the following picture represent autoimmune disorder. In the picture, there is a butterfly-shaped rashes.
It's systemic lupus erythematosus.
Indicating systemic
Lupus.
erythematous. Okay. What is the name of equipment in this picture shows? What is this?
Oropharyngeal.
Oropharyngeal or nasopharyngeal?
Nasopharyngeal airway.
Nasopharyngeal.
Nasopharyngeal airways. Okay. See, oropharyngeal കുറച്ചും കൂടെ bigger ആണ്. Okay. Next question. 21. Oropharyngeal. The client is prepared for thoracentesis. The nurse assists the client to which position for the procedure? What is thoracentesis? Removal of fluid from fluid or anything from where? The thoracic space or the pleural space. Exactly. Okay, so what position you will give? We'll see. Option number 1 is lying in a bed on the affected side. No, affected, you are not supposed to lie down on affected side because we have to insert a needle on affected side. Fine. So A is wrong. B, lying on an unaffected side can be selected. And the C, Sims position. No, Sims, no. Prone with the head turned to the side and supported by a pillow. Prone position is not the safest position. The better position for thoracentesis is sitting with a lean forward position. If that is not okay, then the position is lying on the unaffected side positions. The correct answer is second one, B. Next. The nurse is preparing to insert nasogastric tube to a patient. The nurse places the client in which position for insertion?
High Fowler's.
What is the position?
High
Fowler's position. Okay. What is the indication for nasogastric tube insertion?
For giving the feed.
Patient is not able to take orally, and if patient has aspiration tendency, and the person who has been having a tendency to choke and gastric post-gastric surgery to drain the secretions, there are multiple reasons to insert nasogastric tube. Please listen my question. A client is admitted with gastric symptoms, underwent surgery. Okay, gastric surgery. Okay, so post-surgery patient is on NPO and patient has nasogastric tube is in the place. My question is this: what is the indication for nasogastric tube in that particular place for this situation. Post-gastric surgery, nasogastric tube is in the place. What is the indication? Surgery yesterday, the surgery which the patient underwent surgery yesterday. So what is the basic reason to insert nasogastric tube? In order to drain the secretions. That is a simple reason. Okay. Listen, second question. Child is admitted with a intussusception. What is intussusception?
The colon was reverted.
Susception is telescoping intestine, small intestine into large intestine. So on the screen, you can just look at. This is large intestine. And the small intestine is just telescoping into the large intestine. So it is causing obstruction here. Okay, so in this particular area, the obstruction increases the pressure within the intestine. So it causes pain. So there will be pain, severe pain. And second, there will be current jelly stool. So you can write down intussusception. It is telescoping of intestinal wall into the and the basic signs and symptoms is pain, severe pain, current jelly stool or red jelly mucus tinged stool, red jelly and sausage shaped mass on palpation. Okay, my question is this. In this particular patient also, nasogastric tube is inserted. Reason. What is the reason for insertion of nasogastric tube in intussusception? Please look at the picture. There is obstruction, intestinal obstruction, which is happening here, and it increases the pressure of the intestine. See, in intussusception, what happens? It increases the pressure in the intestine, and that may revert the stool or the content in the large intestine back to small intestine and into the GI tract. So, picture nokka, ividunna idu back edittu. Backflow happens and it will move into the stomach. Okay, and it move into, this is stomach and duodenum. So it will return back to duodenum, jejunum, then it reaches in the stomach and it comes out. So what is coming out? The intestinal content is coming out. Okay, so it should not happen. When intestinal content comes out, it may cause aspiration and respiratory infection and multiple complications. So in order to reduce the chances of complication, or in order to remove the gastric content, you have to insert nasogastric tube. Fine. Okay. So first question was after gastric surgery, why you need to insert a nasogastric tube? So indication of nasogastric tube post surgery is to drain the secretion. Question number 2, indication of nasogastric tube in intussusception. Why? To avoid complications and to drain the gastric content. Okay, because the majority the gastric content will be a fecal content. Okay, so fecal emesis is expected in intussusception. To prevent that and to prevent complication related with that, you need to insert nasogastric tube. Fine. And next question, listen the question. Yeah, patient is diagnosed with a left side weakness and the patient is not completely conscious, where patient's gag reflex is depressed. Patient is there in the neuro ICU. Nasogastric tube is inserted. What is the indication for nasogastric tube in a patient who is diagnosed with stroke? To prevent aspiration. Okay, so you will get questions like this in a different area. Nasogastric tube need to be inserted in multiple patients for multiple purpose. Fine. Okay. Last question, listen. A client is admitted following surgery. Patient has developed a paralytic ileus. What is paralytic ileus? Paralysis of the small intestine and the gastric metabolism. Everything alters and there won't be proper absorption and there won't be proper bowel movement. How would you replace feed or how would you replace nutrition? Client with the paralytic ileus, where the patient's bowel movement is reduced and gastric motility is reduced, and yeah, how would you replace nutrition?
Nasogastric feed.
I will give you options. Number 1, first option is nasogastric feed. Number 2 is gastrostomy feed. Number 3 is TPN. Number 4 is IV fluids with electrolytes.
Gastrostomy.
Nasogastric tube, gastrostomy, TPN, IV fluids.
Gastrostomy.
Gastrostomy.
It's a long-term intervention, gastrostomy.
See, here the patient's peristaltic movement is absent, bowel movement is absent. So whatever you give the GI tract, it is not going to absorb properly. So gastrostomy and nasogastric feed is wrong. Either you can select IV fluid with electrolyte and TPN, any of this. But my question was, how would you replace nutrition? Nutrition need to be replaced through TPN. So the answer for this question is, what is the indication for TPN? What is the indication?
GI disorder, continuous vomit, indigestion,
Indigestion,
surgery, post-surgery,
so the main reason for TPN or purpose for TPN administration is
GI disorder.
not GI disorder, absence of peristaltic movement or absence of bowel movement. Okay.
Okay.
Next question. The nurse develops plan of care for a client with a deep vein thrombosis. Which client position or activity in the plan will be included?
Interesting.
Develop plan of care for a client with a deep vein thrombosis. Which position or activity in the plan will be included? Out of bed activities as desired, bed rest with affected extremity kept flat with the elevation of the affected extremities. Bed rest with affected extremities in a dependent position. So what is the answer?
See, elevation of affected extremity.
Elevation of the affected extremity. So the answer is bed rest with elevation of affected extremity. Next. The client in labor is transported to the delivery room and is prepared for cesarean delivery. The nurse is transferred to delivery room table and the nurse places the client in dash. Trendelenburg position with the leg in a stirrup, semi-follows position with the pillow under the knee, and prone position with the legs separated and elevated, prone position with the wedge under the right hip.
Supine position. D.
So what is the answer?
Supine.
Supine position? Sure. Yeah, supine position with a wedge under the right hip. Okay, next. The nurse is caring for a client who is 1 day postoperative for total hip replacement. Which is the best position in which the nurse should place the client? Sideline on operated side, on the non-operated side with the leg abducted, sideline with affected leg internally rotated, sideline with affected leg externally rotated.
Abduction on the non-operated.
So the answer is
B.
yeah. So here the wrong answer is leg internally rotated and leg externally rotated. And you are not supposed to lie down on an operated side. Yeah. So post hip surgery, you have to immobilize the patient leg and you need to keep the leg abducted. Immobilization with abduction. And obviously, yes, after surgery, any of surgery, we never give affected side position. Fine. So non-operated side with the leg immobilized, abducted by using abduction pillow. Fine. Okay.